It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to this week's episode of Morton in the Morning, your weekly radio show coming to you right here from Morton Hospital, your community hospital in Taunton. It's a new year, and we are looking forward to bringing you some new shows in 2022, and also maybe highlighting some past interviews if there are topics that are timely that our listeners want to hear about. But we also want to hear what you want to hear about this year, and the way you can reach out to us and give us feedback or suggestions for future shows is by sending an email to us at Morton in the Morning. That's MORTON in the morning at STEWARD.org. We would love to hear from you and also hear what health and wellness topics or what hospital services you would like to learn more about this year so that we can line up some interviews for our upcoming shows. Today we have a great show and a couple of interviews with some specialists from our pain clinic, which is located right here on site at Morton Hospital up in our day surgery center. That's been around for a few years now, and they're certainly growing, but they're also accepting new patients, so we'll look forward to learning more about the services that they offer here, how they have grown, and how you can schedule an appointment for a consultation if you are struggling with chronic pain conditions. But first, before we get into our interviews, I want to share some exciting news about an event that we have coming up here at Morton Hospital. It's actually a virtual event, and it is a virtual hiring event. We certainly look forward to being able to have these events back in person, but for the time being, while we're still on heightened restrictions with COVID-19, we are doing this event virtually, but interviews may be scheduled either virtually or in person for qualified candidates. But our hiring event is going to be on Tuesday, January 25th from noon to 4 p.m., as well as on Wednesday, January 26th from 9 a.m. to noon. So for this particular event, we are looking for candidates for a number of clinical and non-clinical career opportunities, specifically registered nurses, including nurses for our behavioral health unit, our intensive care unit, our emergency department, our operating room, and our general medical surgical floors. We're also looking for nursing assistants, patient safety sitters, mental health associates, environmental service aides, and security guards. So if you or anyone you know is interested, this is a great place to work, and we would invite you to sign up to attend that event or browse our list of available careers online. So to sign up for our hiring event, you can find the event page on Eventbrite by searching for Morton Hospital Virtual Hiring Event. You can go to our Morton Hospital Facebook page, which is facebook.com/Morton Hospital MA. Or go to our website, mortonhospital.org, and go to the events page on our website. And you can certainly always browse a full list of our available job opportunities at jobs.steward.org. So we are looking forward to that event, and hopefully we'll have a lot of folks from our community sign up and come join our team here at Morton Hospital. So I have a few other announcements to share later in the show, but I do want to get into our interviews today because I'm very excited. We have a couple members of our team up in our pain clinic, so let's get started. Okay, so to kick off today's show about our pain clinic, we are in our pain clinic in the Day Surgery Center at Morton Hospital with Dr. Daniel Levin, who is one of our specialists. Welcome, Dr. Levin. Thanks for being here.
Thank you for having me.
So tell us a bit about yourself, what your actual area of expertise is, and about your background as well.
Sure. So my background is in pain medicine and anesthesiology. Going way back to the beginning, I grew up in Chicago. Grew up a diehard Bulls fan and Cubs fan, so hopefully that's not too objectionable out here. I did my undergraduate studies at the University of Illinois in molecular and cellular biology, and then went to the University of Chicago for both medical school and stayed there to do my residency training in anesthesiology. After that, I moved out to Massachusetts to do my fellowship in interventional pain management here in the Boston area. And here we are now.
Okay, so how long have you been in Massachusetts?
Well, this is, I think my third year in Massachusetts. So I was, as I said, did my fellowship at Massachusetts General Hospital and then came right afterwards to Morton. So
okay.
Going on the, I guess, third year at Morton, so fourth year.
Okay.
In Massachusetts.
So that's not long enough to convert you to a Patriots fan just yet?
Probably, it's going to take a while.
I tried. Okay. So what intrigued you about the field of interventional pain medicine?
Yeah, so my first exposure was actually very early on and incidental through just a kind of a research project in medical school, and then I kind of came back to it as I was proceeding through my anesthesia residency. I observed procedures, I kind of enjoyed the anatomy, and also the ability to treat various pain syndromes via minimally invasive approaches. Later, as a resident, rotating through the pain clinic, I was really drawn to kind of implementing those procedural skills that we have as anesthesiologists with the added benefit of building more lasting relationships with patients. So, it's particularly rewarding to observe as our treatments allow patients to return to their daily lives after kind of years of suffering with chronic pain, whether in the form of personal interests, activities, relationships, or even getting back to work.
Okay, that's great. And what specific areas do you specialize in or have a special interest in within the realm of pain management?
So, there's a lot of different pain syndromes out there, ranging from full body pain to kind of more specific pain generators. And at the end of the day, the kind of bread and butter of what we do in interventional pain clinics is oftentimes related to the spine and back and neck pain.
Okay.
Certainly we specialize in doing fluoroscopic or X-ray guided procedures, but we also do address things like joint pain and other types of chronic neuropathic pain.
Okay. And it's a pretty high volume clinic, thanks to your joining, and also we have a second interventional pain specialist, Dr. Todorov, as well.
Mm-hmm.
So what are the conditions that people are most frequently coming in with?
Sure. So as I kind of alluded to, the most common presenting problem that we see here is chronic back pain. Mm-hmm. And I think that's probably consistent for most pain clinics. Sure. Followed probably closely by chronic neck pain. So things like degenerative disc disease, herniated discs, facet joint disease, to name a few. We also see many patients for arthritic joint pain, meaning pain due to arthritis, persistent pain after things like knee replacement or after back surgery, and then kind of a myriad of problems that fall into the realm of what we consider neuropathic pain or pain due to chronic nervous system dysfunction.
Okay. Well, it sounds like we are able to treat a wide range of pain-related conditions, as you listed, and I'd like to talk a little bit more about the specific treatment options that we offer here. But first, it is time for our first commercial break of today's show. So we are here with Dr. Daniel Levin of the Morton Hospital Pain Clinic, talking about the services here that are available for anyone suffering from chronic pain or other specific conditions. And when we return from our break, we're going to talk about some of those treatment options and get to know a little bit more about Dr. Levin and the services that we offer here, as well as the pain clinic team here at Morton Hospital. So stick around and we will be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to this week's episode of Morton in the Morning. If you're just tuning in at the beginning of our show today, I was talking about an exciting event, a virtual hiring event that we are hosting here at Morton Hospital on January 25th and 26th, and you can find more information about that on our website, mortonhospital.org, on the events page. Please spread the word to any friends, family members, or yourself if you are interested in a new career. We have many clinical and non-clinical career opportunities available. So we're hoping to have a really successful hiring event so we can continue to grow our team here at the hospital. Also this week, we were happy to welcome 8 new team members on Monday at our new hire orientation. So we welcomed a variety of personnel, including security guards, mental health associates, MRI techs, and physical therapy assistants. So welcome to our new team members. We're very happy to have you here at Morton Hospital. And as I mentioned again, we are looking forward to continuing to grow our team at our upcoming hiring event on January 25th and 26th. So check out our website, check out our Facebook page for more information about that so that you can sign up and share that information with others. So today we are talking about the pain clinic at Morton Hospital and our pain management services. And we are sitting here in our pain clinic with Dr. Daniel Levin, who is a pain management specialist in our pain clinic, one of 2 providers that we have in our clinic. And before the break, we were talking a little bit about the specific types of conditions that our pain clinic commonly treats. So the pain clinic is located in our day surgery center, but that doesn't necessarily mean that treatments are surgical. Is that correct? What are the modalities that you offer?
So fundamentally, we offer what I'd consider a multimodal approach.
Okay.
And we generally do an evaluation in the beginning when we meet each patient and try to tailor a plan to their individual needs and diagnoses. So this multimodal plan can include treatment modalities like physical therapy, medical management or medication management with a focus on non-opioid medications, and then a vast array of interventional therapies, including injections, joint injections, spine injections, things like radiofrequency ablation, just to name a few. Okay.
And you mentioned physical therapy. Are there any other specialists or departments that you work closely with in treating patients?
Yes. So we work with, especially being in a hospital, we work and collaborate with multiple other specialties. The most common people we probably interact with are orthopedic surgeons, so whether they be joint surgeons who do hip and knee surgery, or a lot of spine surgeons, whether orthopedic surgeons or neurosurgeons, we'll frequently collaborate with them. And then, of course, we'll collaborate with our psychiatric colleagues, because a lot of pain patients do have other issues with mood disorders like depression and anxiety, and that plays into their pain syndrome. And then a vast array of other specialties that we interact with based on the patient's needs. Okay.
And how often would you say that patients coming in do require surgical intervention? Is it a small percentage?
So I'll kind of clarify a little bit. So when I say what we do in our clinic is largely not surgical.
Right.
We use minimally invasive targeted injections and procedures to treat patients, many times with the hope of sparing patients a surgery. So I don't have a great number as to how many patients who come to our clinic get an intervention. But I would just say that each patient is evaluated on an individual basis, and based on factors including, their response to more conservative treatments like medications, physical therapy, and then the patient's own kind of desires and needs. We'll come up with a plan that may include some medications, may include interventions, or may include both.
Okay.
And then, at times that can include referral for a surgical consultation, but not necessarily.
Yeah, but the goal is to treat through other interventions and then maybe surgery as a last resort if needed.
That's right.
Okay. So over the past several months, many offices, departments have offered, telehealth visits. Did the pain clinic offer telehealth through the COVID pandemic?
Yeah, we began doing telehealth pretty early on. I think that it's been a great tool for us to continue to provide care to our patients. Obviously in the beginning we were not able to utilize the interventional therapies because they're considered elective procedures, so we were able to continue management with medications and other modalities via telehealth. Now that we are back and able to utilize those procedures in a safe fashion, we still are offering telehealth and in fact encouraging patients to utilize telehealth, particularly for follow-up visits, but also for new patient consultations. We do have the ability also to see patients in our clinic, be it the patient desire to be seen in the clinic, or if there's a need for us to examine the patient due to some sort of issue that's come up, obviously for procedures they're done in the hospital.
And of course, because the clinic is in the hospital, the clinic follows all the same safety procedures, protocols, cleaning, so people really should feel safe coming into the clinic. There's definitely, there should be no hesitation if you actually have to do an in-person visit. And I know with a lot of the providers that I've spoken with about telehealth, they really stress that there aren't many barriers to telehealth unless you actually have to do hands-on treatment, and that really it's an added convenience for people, and you get to sort of see them in their natural setting, which is helpful as well. They might be a little bit more relaxed. Is that true?
Yeah, to this point in time, it's been a great tool. I think provided increased patient access to healthcare, and particularly to our clinic, because many of our patients have challenges with transportation and getting to and from visits, so it kind of obviates the need for that extra step or extra barrier. And I agree that for the most part, the telehealth visits are very effective. We can use both video telehealth as well as audio alone telehealth for patients who have trouble using a video-based platform.
That's great. So let's get into some, general advice that you have, not necessarily direct medical advice, but so if someone is experiencing any sort of physical pain, it might be bothering them every day. At what point do you recommend that they should really seek help from a specialist?
So that's a difficult question to answer, because pain can be a manifestation of kind of a long list of underlying problems, depending on what the pain presentation is. And I think generally when a patient begins experiencing physical pain, it's important that they consult with their primary care provider, because a lot of times they'll need to initiate a workup to look for any underlying cause of what that pain may be. Depending on the outcome of that workup and what the provider finds, that provider will initiate a kind of an initial treatment, and when the pain remains persistent despite that conservative management or initial treatment, then consultation with a pain physician is appropriate. And I think that's a decision that's a good conversation always to have with the primary care provider, because they're very aware of when the time is to go and seek kind of a higher level of expertise. Okay, great.
And we will be talking later in the show with Amber, who is the clinic's referral coordinator, about what that process might look like if someone needs a referral to come here. So are there any general tips that you could offer for chronic pain prevention?
So in general, I would say the best methods we have to prevent chronic pain is to lead an active and healthy lifestyle, and that applies to both kind of physical and mental health, because there are components of both within chronic pain syndromes. I think eating well, exercising, maintaining a healthy weight, and avoiding things like smoking and substance abuse can all contribute to preventing the development of chronic pain.
Okay. And especially with back pain, I mean, I myself actually have chronic back pain. It could be due to posture also. Is that correct?
There are a lot of factors that can come into play.
Yeah.
You know, I think there are certainly behavioral features of it, like posture, and also there are just genetic components to it.
Sure. But you mentioned exercise, and I'm sure things like stretching can help to strengthen the muscles as well.
Yeah, absolutely.
Okay. So is there anything new that you've recently started offering in the clinic, or are there any new services or expansions to come?
So, I think the field of pain management is evolving, and we're constantly aiming to collaborate with other services within the hospital, as well as to incorporate new treatment modalities in order to promote the optimal patient experience and optimal treatment outcomes. And that does involve kind of bringing in and working with some representatives from various device industries and trying to incorporate new technologies. So we're constantly trying to incorporate the newest treatments.
Okay, great. And then before my last question, so the clinic itself, can you just talk about the team, like who's involved in the clinic actually caring for patients or facilitating their care?
Sure. So we're a relatively small clinic. We have Amber, who will be on next, who kind of does a lot of the administrative end of the spectrum of our work.
Okay.
We also have a practice manager who helps out with that administrative side and sometimes interacts with patients as well. Then we have medical assistants who will field phone calls and help coordinate patient visits, take the patients in their rooms, and also take calls and get messages from me to the patients. And then, of course, myself and then my colleague, Dr. Todorov, both work in the clinic. Other than that, that's on the clinic side. Then on the procedural side, there's a different team because we operate through the same-day surgery area. So there's a vast array of kind of nurses, coordinators, and schedulers, and so they work on the hospital side and work alongside our secretary, who works in our office but coordinates with the hospital.
Okay. And you had mentioned that some of the procedures are elective procedures. So I would imagine that as a safety protocol, we have this policy in place that patients coming to the clinic would need to have a COVID test in advance. Is that for all visits or just for the injections and other interventional procedures?
So that is for the vast majority of our procedures. Any procedure that's coming through the same-day surgery area do need to get a COVID test 3 days before. There are some very minor injections like intramuscular injections or injections into small joints that can be done in the office, and those do not need to have a COVID test.
Okay. But you or Amber would let patients know prior to if they require a COVID test?
Yes, I always discuss it with the patient when we're meeting for our consultation, and then, of course, when they're being scheduled, Amber gives them kind of more of the logistical rundown.
Okay. And just so our listeners know, our COVID clinic does continue to operate. It's a walk-in clinic. We're open Monday through Friday, 9 a.m. to 5 p.m. for general COVID tests, but we also do open up and offer some extended early morning hours, 7:30 a.m. to 9 a.m., for specifically those patients who are coming in because they need the COVID test for an upcoming procedure or surgery. Now, the key here is you do need a provider order in order to visit the clinic. So usually the provider you're seeing that's doing the procedure or treatment will order that for you and just send the order into our clinic. So one last question for you, Dr. Levin. What have you enjoyed most about joining this team and providing care in this community?
So, I came to Morton right out of training, after fellowship, and I think that joining and practicing at Morton has been a great experience so far. I've had the opportunity to collaborate with many other dedicated providers, to work with a great team of nurses, ancillary staff, and administrators, and of course, most importantly, the privilege of getting to know, treat, and hopefully improve the lives of our patients.
Okay, excellent. Well, we've been very fortunate to have you and to have grown our clinic over the past few years, so we appreciate that. And hopefully, next time we speak with you, we can say that you're a diehard Patriots fan.
Yeah.
Let's hope for
Good
that.
luck.
Well, thank you so much for your time. We really appreciate learning a bit more about the clinic and the types of treatments that you offer. We appreciate you being here.
Great. Thanks for having me.
All right, thank you. Okay, thank you again to Dr. Levin for taking the time to talk a bit more about the services offered. We really enjoyed learning about our pain clinic, and we are going to be back with more, but we are ready to take our second break of today's show. We're just at the halfway point, so stick around. We'll be right back after these short messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
If you're looking for weight loss that lasts, look no further than the Stewart Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the second half of today's Morton in the Morning show. I'm your host, Julie, and today we are talking about our pain clinic here at Morton Hospital, which, if you are not familiar with, is located right up in our day surgery center. It's been around for a few years now, and it's growing, and we have two providers. For the first half of the show, we spoke with Dr. Daniel Levin, who is one of our interventional pain specialists, and we also have Dr. Todorov, who is here with our team. And now we are ready to speak with another member of our pain clinic team who also plays a very important role. Before we do, just another friendly reminder about how you can reach out to us here at Morton in the Morning. It's the new year, and we want to hear from you about what topics you would like to hear about on future shows. So you can email us at any time at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. Send us an email. Let us know how you're enjoying the show. Give us any feedback or follow-up questions, and let us know what else you'd like to hear about in our upcoming shows. All right, so for the second half of today's show, we are now sitting here with Amber Rogers, who is the referral coordinator for the pain clinic. And in speaking with Dr. Levin, you play a lot of, big important role here. You're sort of the gatekeeper for the pain clinic. Is that right?
Yes, I would say.
So tell us about your role and what you do.
So I am a referral coordinator. I pretty much, I'm an overall around person. I do everything besides the referral coordinating. Mm-hmm. I pretty much I catch referrals. I do book new patient appointments. I do procedures. I do authorizations just to make sure your insurance approves of the procedure or even the appointment.
Okay.
I do a lot of the background work, but I am the face that you see when you do come up. So I consider myself the personality of pain.
Okay. I love that, and I would agree with that because you've been a friendly, smiling face throughout the hospital as well, because you've also worked in various roles at the hospital before you joined the pain clinic. So what interested you in joining the pain clinic team?
So I just thought by me joining it'll help me out with my clerical background. I've always had customer service. Customer service has always been my forte. But the pain, I don't know, it was something different about it. My mom, she has MS, so she's seen pain specialists, but never knew what it entailed. Yeah. So by me, it's something different. Sure. And I wanted something different, and I felt like I can contribute a lot. A lot of the patients they're in pain.
Yeah, right.
So by me just keeping a smile on my face, I think that brought a lot to the clinic, and
sure.
So just kind of uplifted.
Yeah. Absolutely.
Pain always sounds like a sad thing, but when I want that experience to be an enjoyable experience.
Absolutely. And Dr. Levin had mentioned too that it's a very rewarding field because most of the time you're able to help people relieve their pain.
Yes,
So,
exactly.
and so just out of curiosity, what areas did you work in the hospital previously?
So I started off in the kitchen as a dietitian.
Sure.
And then from there I went to environmental. And then from there, I went to registration.
Okay.
And then now I'm here at the pain.
All right.
So I do believe that all of those did help me. Like, it did teach me the ins and out of things. By me doing nutrition, I was able to communicate with the patients a lot. Like, I'm one-on-one because I'm in the room. Even with environmental, I had to clean the room. So I don't know, I just got a better feel of the patients, and I was able to kind of communicate with them a little bit more. So now that I'm in pain, I'm just like, hey, hey, how you doing? I remember you.
Well, that's great. Well, you're definitely building up that resume for sure. I can see why you are a good fit for customer service roles. So, thank you. So tell me about, what the day in the life of a referral coordinator in the clinic looks like, because you see patients twice a week. Is that correct right now?
Yes.
Okay. So tell me about your typical day when you're seeing patients.
Typical day, it does consist of a lot of careful listening. I say that because a lot of patients do call, and sometimes they don't know where their pain is coming from, so I do have to listen carefully, and just a lot of reassurance just to let them know I'm making sure that I understand the patient's needs. That way I could communicate it with the doctors. I do pretty much what needs to be done for both the clinical and the patient. So I'm that middleman.
Okay.
So any way I can please, so be it.
Great. A lot of administrative stuff, the scheduling you mentioned. So with regard to scheduling patients, do patients need a referral to come to the clinic, or can they call and self-refer themselves, or do they have to have a doctor's referral?
So they can call to self-refer, but we do recommend, we prefer honestly to have a referral, and that's only because for the provider's sake. So we want to know where your pain is coming from, and the last note you had with your PCP as far as like your last MRI, wherever your pain is coming from, because they always document that.
Yeah.
So just having that documentation sent to us, that it's very helpful. We need it for insurance purposes too.
Sure.
But like I said, we do accept self-walk-ins, I'm gonna say like that. Yeah.
Sure. So when you're registering patients, what other types of information do you have to collect from them before they're seen by the specialists?
Collecting physician, that's why I say a referral is helpful, because we want to know specifically where your pain is coming from.
Yeah.
And not only that, depending on what you're coming in for.
Yeah.
So I say that because one physician does Botox, the other one does more on SI injections.
Okay.
So I just want to make sure I direct you into the proper physician. I'm sorry. I do need your demographics. So I do need important documents as far as your ID, your insurance. If you're coming from workers' comp related issues, I need that workers' comp information, like your adjuster. So that's why all those documents, those papers are important, and it's just to help better serve the patient.
Right.
So,
I know sometimes there is a lot of information that we have to collect in different areas, and I know some patients will say, well, you're asking me the same information that somebody else already asked me, but again, you said it really is for safety reasons, but it's also just to make sure that we have everything correct and we can
we can better
serve
suit
them.
you. Exactly.
Okay, so Dr. Levin did tell us a bit about the whole team in the clinic. What are the hours of operation?
Hours of operation are Monday through Friday from 8 to 4 p.m. We do book patients after 4 p.m., but as far as contacting our office, the phones are closed.
Okay.
But we are here till 5 p.m.
Okay.
So I would just say 4 to 5.
All right.
I'm sorry, 8
Isn't
to 4.
it? And is it certain days that you see patients for like office visits / consults, and then certain days that you schedule all procedures? Is that how it works?
So Monday are telehealth for both of the physicians.
Okay.
Tuesday are office visits for Dr. Levin and procedures. Wednesday's another telehealth for Dr. Levin. Thursday are procedures for Dr. Levin. And then Friday are is it procedure? Yeah, procedures first, and then office visits for Dr. Todorov.
Okay.
Yeah.
Okay.
So it's a
great.
little confusing, but we'll get it together.
Well, yeah. well, good thing you're here to keep track of it all, right? And so, what has been your favorite thing about working in the pain clinic?
I would say honestly, it's dealing with the patients. I get to see some come not so happy, but then when they leave, it's like they're a whole totally different person. Of course, their pain is kind of I don't want to say gone, but it's at a standstill, so they're better. I get to work with the doctors personally. Like I know a lot of times with the COVID thing, they weren't able to communicate with the patients as much as possible because it was a whole remote thing. But I was there to kind of I went above and beyond and just kind of got the information they needed, helped out with the patient. If that patient wasn't able to receive something from another physician because of a lot of offices aren't open, I was, for whatever reason, I figured it out and I got the information I needed. So I just loved being here. I love helping out. I love seeing the patients walk away with a smile. Like I had a patient today, I walked her to the Quest. We don't transport to the Quest, but I didn't want her to go alone. And then, me telling her, go this way, left way, it just wasn't right. Yeah. So I went over there, I told Dr. Levin, like, hey, I'm leaving the desk for a while. But just to let you know, I'm going to help out a patient.
Yeah.
So.
So technically you are a Steward Medical Group employee, but everybody at the hospital, you all still feel like, you're part of the hospital team. It still feels like you haven't really left us. You're just in a different role.
That's what I said. No, I'm not leaving.
And we always see your friendly, smiling face. And since the clinic so Dr. Levin was saying that, you've been doing a lot of telehealth since the beginning of the COVID pandemic, but that we were able to reopen for elective procedures once the governor lifted those restrictions as part of phase 2 in June. And it's been pretty busy since then.
Our volume, I think, has been the highest whatsoever. I don't know, because we had to kind of calm down and, but it's been going and it's still going. Like Dr. Levin is booked out till October.
Wow.
But, if there is a cancellation, I'm good at that. I will contact a patient that's been waiting and get them in and seen.
Yeah. Or if there's like an urgent situation.
Oh yeah, we'll make some adjustments and we will get to that as soon as possible.
Okay, excellent. Well, it sounds like a great team up here, and it sounds like you're going above and beyond to give the best patient experience. So thank you. It was good to learn about the process for getting into the pain clinic. Like I mentioned, you're sort of the gatekeeper, or the what did you call yourself?
Oh, the personality.
The personality of pain, right?
Yeah. No pain, no gain. That's it.
All right. Well, Amber, thank you so much for all that you do in the clinic, and thanks for sharing with us today. Anything else you'd like to add?
No, just come by and see us anytime. You please feel free to call. If you don't get an answer right away, leave a message and I will give you a call back.
Okay, and the number to the clinic is
508-828-7186.
Excellent. Awesome. Well, thanks, Amber. We appreciate you being here.
Thank you.
All right, and keep smiling and being that personality of pain.
Oh, yeah.
Thanks so much.
Thank you.
Okay, well, that wraps up our time today with our pain clinic specialists. We have Amber, our referral coordinator, and earlier we talked with Dr. Daniel Levin. And as Dr. Levin mentioned, we also have Dr. Todorov on our team. So he and Dr. Levin are both accepting patients in our pain clinic. Again, if you'd like to learn more or see if you can get a referral, you can call our clinic at 508-828-7186. As Amber mentioned earlier, a provider referral to the clinic is preferred, but you can always call for more information, and Amber or a member of our team would be happy to speak with you. So we are going to take a final break for today. When we come back, we're just going to share some additional hospital announcements with you. So if you want to hear about those and what's happening around the hospital, what's coming up, stay with us and join us for the last segment of today's show. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Hello, everyone, and welcome back to the final segment of today's Morton in the Morning show. Thank you so much for listening. Today, we were talking with two of the team members from our pain clinic here at Morton Hospital, up in our day surgery clinic. And they were talking a bit about the services offered, the types of conditions they treat. And if you'd like to schedule an appointment or learn more about our pain clinic, you can go to our website, mortonhospital.org, or call our pain clinic directly at 508-828-7186, and either Amber, who we spoke to during the second half of today's show, or another member of our team would be happy to speak with you and see if you qualify for a consult with one of our pain management specialists. So for the final part of today's show, I wanted to share a few updates about some other new doctors and specialists who have joined our team over the last couple of months. Most recently, we have welcomed, just at the very end of December, Dr. Deepthi De Silva to Morton Hospital and Steward Medical Group. Dr. Silva specializes in medical weight loss, and she joins our Steward Center for Weight Control team, and she will serve as our medical director for medical weight loss management. She is board certified and has a special interest in weight management, diabetic management, and aesthetic medicine and body contouring. So she is now seeing patients at our Center for Weight Control, which is right here in Taunton, right across the street from Morton Hospital in the Liberty Medical Building, and that's at 91 Washington Street. And within the next few weeks, she'll also be seeing patients in Middleborough at our Medical Weight Loss Management of Middleborough office, which is in the Compass Medical Building in Middleborough at 8 Commerce Boulevard. So we are very happy to have Dr. De Silva. If you want to learn more about our Center for Weight Control, which now includes Dr. De Silva, as well as 3 bariatric surgeons, you can call our center and learn more, or to schedule a consultation. You can call 508-301-2434. Again, that's 508-301-2434. So again, we're very happy to have Dr. De Silva. She rounds out our team, and now we have bariatric surgeons as well as medical weight loss specialists and a full team over there across the street from Morton Hospital. And we also continue to offer our virtual monthly weight loss surgery info sessions and support groups. Those are on the last Wednesday of every month from 3 to 4 p.m. And those are held via Zoom, so you can sign up online if you go to mortonhospital.org, click on our events page. We have one coming up toward the end of this month, and those sessions are for anyone who wants to learn a little bit more about weight loss options available at our center, but also those who may have already had weight loss surgery or are trying to maintain their weight and are looking for general tips, nutrition tips, etc., that are shared every month. There's a different topic that's shared to help you and support you throughout your weight loss journey. So again, our Center for Weight Control can be reached at 508-301-2434. A couple of other new providers that have joined us. Shannon Houlihan, who is a family nurse practitioner. She joins our SMG Taunton Medical Office. So we have a full team of providers over there right on Court Street, multiple doctors as well as mid-level providers, and she is the newest addition to that team, and she is now accepting new patients, and she can be reached at 508-821-2500. Again, that's 508-821-2500. And we have also welcomed a new member to our SMG Women's Health of Taunton team. So that is located in the Thayer Building, Suite 1000, which is right attached to Morton Hospital. And that office specializes in obstetrics and gynecology. And new to that team is Amanda McBaron, who is also a family nurse practitioner specializing in obstetrics and gynecology. So she joins Dr. Molina and Dr. Curry in that office and is accepting new patients. And if you'd like to learn more or to request an appointment, you can call SMG Women's Health at 508-824-2111. Again, that's 508-824-2111. And we have been so fortunate to continue growing our medical staff and specialists here at Morton Hospital. Those are just 3 of the many new providers who have joined us most recently. But if you want to search for a provider, a primary care provider, if you need one for the new year so you can schedule your annual wellness visit, or any specialist, you can go to our website and check out our Doctor Finder tool. And you can search any specialist there by specialty, by location, and many more different parameters where you can narrow down your search. So it's a great tool, Doctor Finder. Find it on mortonhospital.org. And again, welcome to Dr. De Silva, Shannon, and Amanda. Welcome to Morton Hospital and to our Steward Medical Group team. So that just about wraps up today's show. Thanks again to our pain management team for coming and chatting with us. Looking ahead in the next few weeks, we have a couple new shows that we're lining up on some brand new topics. So we are looking to do an interview with some of our team members from our MORCAP, Substance Use Disorder Treatment Unit. I know that a few months ago we did a show about MORCAP as it was just preparing to open, but now that we are fully open, we want to give you an update on how that's going and introduce you to some of our team members, including our medical director for MORCAP, Dr. DeLima. We are also interviewing for a future show to talk about our Center for Sleep Medicine. So our sleep lab is right across the street from Morton Hospital in the Liberty Medical Building. And we want to talk to them about their services, but also talk to them because they recently earned a 3-year reaccreditation for the sleep lab from the American Academy of Sleep Medicine. So congratulations to our sleep lab team, and we look forward to chatting more with them about what that accreditation means and what types of services they offer to people in our community who have sleep disorders or other troubles sleeping. So those are a couple shows that are coming up in the next few weeks. But again, we would love to hear from you. Tell us what you'd like to hear about. You can reach out to us at any time at our email address, which is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. You can send us an email anytime to share feedback or ask any follow-up questions. Maybe you missed a phone number on one of our shows and wanted to just get some contact information. We'd be happy to provide that to you. But again, we also want to hear, what topics, what health and wellness subjects you'd like to hear about this year so that we can line up those interviews for you and share some additional information. And also, if you miss any of our shows, you can check out our Facebook page, which is facebook.com/Morton Hospital MA. And we often share the link to our radio shows that you can find online. You can listen to them right on YouTube. Again, check out our Facebook page if you want to listen to any past shows that we have done. Thank you again to our pain clinic team for joining us today. Thank you to all of our listeners for tuning in. And we look forward to hearing from you if you want to send us an email about what topics you'd like to hear about. And we also look forward to joining you again next week. From all of us at Morton Hospital, we hope you have a happy and healthy week. And thank you for listening in to Morton in the Morning. If you're looking for weight loss that lasts, look no further than the Steward Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.